When you find a blockage, one of the vessels completely blocked, what are you going to try and do to reestablish the blood flow?
Right. Reestablished blood flow is probably the most important. For every 30 minutes you're having a heart attack or this STEMI or urgent heart attack, there's an 8% increase in mortality. So time
every 30 minutes, increase 8%. Keep going. So time is precious.
Time is muscle, time is mortality, time is everything. So it's as fast as we can go. We generally, once we get up there, we take a very soft wire and float it down the artery. The plaque is usually soft at that point. We don't want to traumatize the vessel. So once we get a wire or a rail to get the balloon down, then the balloon goes down and we can usually restore flow very quickly.
The balloon goes down.
Yeah.
What do you mean by the balloon?
So we have tiny balloons. The smallest one we have is 1.5 millimeters up to 5 and 6 millimeters.
So 1.5 millimeters, that's less than the size of an eraser. Yeah. The old pencil eraser. Right. So it's really very, very small.
Very tiny.
And you've got a balloon. Is it shrunken down and you blow it up, or what do you do with that balloon?
All those balloons come in a prepackaged box. They're crimped down, and again, we need a low profile to go through a blockage. Once we get across it, then we inflate the balloon, usually with some dye in there so we can see the balloon inflate, but that allows to displace plaque, displace blood clot, goes downstream and washes out.
And where does the word stent come in there?
Yeah, so stent's a way to stabilize the artery. Before we had stents 25, 30 years ago, we would do an angioplasty, and we had very high rates of that artery collapsing and thrombosing, probably 20, 30% of the time.
So angioplasty is just the balloon?
Angioplasty is just the balloon. Now that we have a stent, which is a tiny metal scaffolding, think of it as like the inside of a pin spring.
I call it a slinky.
Yeah, exactly. It's a slinky. So we get into that area. It's again crimped on a balloon too, and it allows you to open the artery but keep the artery stabilized, and so that we don't have the collapsibility.
Different kind of stents?
Yeah, there's two different main types of stents. One is a bare metal or a non-drug coated stent, and one is a drug coated stent.
What drug coated sounds like more advanced. What does it do?
Is. So when we first started placing stents, we had just a metal object we put in the body. Problem is the body sees that as foreign, and we start to get scar tissue formation on the inside of those stents. And bare metal stents re-narrow. Our chance of having to go repeat work on the patient was up to 15% with our bare metal stents.
So you reestablish the blood flow. Can you see the heart pink up, and when the patient wakes up, he's got good blood flow to heart, hopefully, and then you let him do what?
Yeah, again, most of the time patient's awake. We have conscious sedation, so patient knows what's going on. We like to see the EKG changes come down immediately, and 80–90% of the time patients almost have immediate relief of their chest discomfort.
So eventually they go back home and they don't have to do anything, or that's the time to get down to business?
No, that's the time we need to make big lifestyle modifications.